Assalamu alaikum rahmatullah. The patient is the center of medical universe around which all the effort of doctors revolve. With this theme, we already start our ethics portion. Today we will discuss about the duties of a registered medical practitioner or duties of doctors. Assalamu alaikum rahmatullah. Ami Professor Shah, Professor of Forensic Medicine and Toxicology, Ibrahim Medical College. Objective of today's discussion of today's session, these two already I have discussed in the last class. Instead of that, I will a bit repeat this. That is right and privilege of patient, right and privilege of doctors, and duties of patient. Though right and privileges of doctors and patient already we have discussed it. Today a bit repetition have to be made. At the end of the session, you will be able to enlist the duties of a registered medical practitioner, that is doctors. You will be able to define professional secrecy and privileged communication. Discuss the rules of the professional secrecy, conditions where you are privileged to communicate. Let's see what are the rights of a doctor. Right and privilege of a doctor, right to practice medicine. These medicines include it includes surgery, medicine, gynae, of all this. That is, the practitioner, doctor can practice medicine all over the country. Doctors can conduct the delivery. Doctors perform operation. So, right to practice medicine, it includes all the branches of medicine. That is, he can practice medicine, he can practice surgery, he can practice the gynae ops and the allied branch of those. Doctors have the right to conduct the delivery, to perform the operation, etc. He has the right to choose the patient. He has the right to add title to his name. Doctors have the right to take appointment in public as well as private hospital, has the right to issue certificates, has the right to give evidence in the court of law as an expert witness. Usually, doctors are can play either expert witness or as a common witness. He can give evidence. Whenever the doctors explain suppose an injury certificate, the site, length, breadth, then he will be a common witness. Whenever he puts his opinion, like this is incised down, this is a lacerated down, this is a blunt force injury or sharp force injury or sharp pointed weapon caused by the sharp pointed, etc. Age was 6 within the 6 hours, etc. That is, whenever he draw an opinion, he will be expert witness. The doctor has the right to give evidence in the court as an witness. Doctors have the right to recovery fees. These are the rights and privileges of doctors whenever he become registered from the BMDC. Without registration, you cannot use your medical knowledge You cannot practice your medical knowledge in a country without registered from the BMDC. Your medical degree is useless. That's why I mentioned this topic as name as the duties of a registered medical practitioner. Now come to the rights of the patient. Patient has the right to choose his own doctor freely. The patient has the right to access to healthcare facility regardless of sex, age, religion, and social status. Doctors, patient has the right to access emergency service, to be recorded and demand summary of his condition, to be treated with care, compassion, respect, and dignity without any discrimination. These also the rights of the patient. Patient has the right to be treated with privacy and confidentiality by maintaining confidentiality. Patient also has the right to get information regarding investigation, regarding diagnosis, regarding treatment plan, regarding alternative, regarding risk involved, regarding complication, regarding prognosis. All information regarding this has the rights of the patient. Patient also has the right to know, refuse, or take part in decision making. Patient has the right to maintain his record by the doctor or healthcare professionals. Patient has the right to be treated continuously or continue to his treatment. And patient has the right to be treated with the comfort. And if there is any negligence issue, then patient has the right to get compensation from the concern. Now, patient's duty are three. Patient will provide detailed history. He will not suppress his history and follow strictly all the instructions regarding drug, regarding diet, regarding advice. If the doctor give advice to take the drug after meal, instead of taking after meal, he take the empty stomach. And if there is a perforation of that drug, this complication for this complication doctors is not liable. That's why patient duty is to follow strictly all the instructions regarding not only drug, but also regarding diet, also regarding all the other advices. Lastly, the patient has the duty to pay reasonable fees. Now come to the duties of a doctors. We already discussed in our previous lecture that International Code of Medical Ethics define three sets of duties for the doctors. Number one, duties in general. Secondly, duties towards sick and duties to the colleagues. And previously also discussed this. Duties in general, doctors should maintain the highest standard of professional conduct. Doctors should practice profession uninfluenced by motives of profit. Following practice are deemed unethical. Hence, this should not be done by a doctor. Self-advertisement, except authorized by the National Code of Medical Ethics. Collaboration, where the doctor has no professional independence. Receiving money other than a proper professional fees, even with the knowledge of the patient. These are the things deemed unethical. Any act or advice that weaken physical or mental resistance used only for the patient interest, not for the other issues. Hence, any act of the doctor or advice of the physician that weaken the physical or mental resistance used only for the sake of the patient. Use great caution in divulging discoveries or new techniques in research projects, etc. Certify or testify only to what who is personally verified. Doctor's duty to act sick. Bear in mind the obligation of preserving human life. Whenever an examination or treatment beyond the doctor's capacity, he should consult another doctor or refer to a proper place, proper person. Shall preserve absolute secrecy on all he knows about his patient because of confidence entrusted to him. Give emergency care as humanitarian duties unless assured that others are giving such care. Duties to colleague, behave as he would have them behave to him. Must not enlist passion from his colleague. Observe principles of Declaration of Geneva. These are the duties that are described for a doctor in the International Code of Medical Ethics. Now let us see what are the duties that is prescribed by our BMDC. Declaration, Code of Medical Ethics, Etiquette. In that code, you'll see this Declaration of Geneva Declaration 1948 that was amended different time, lastly in 2006. This declaration is adopted by our BMDC as a declaration to get a registration from the BMDC. So this declaration is the Declaration of the Geneva 1948 that was amended in the different lastly in 2006. Though another amendment was already done in the 2017, but it is not yet published in the textbook. Our BMDC accept the BMDC which was at the Declaration of Geneva, which was amended in 2006. Duties of physician in general: maintain highest standard of character of physician. You should know the standard of character of physician. Perform sound medical practice. Maintaining medical records. Display registration number. Use generic name of drugs. This use of generic name of drugs in our country, that is also ordered by the High Court. Maintain highest quality assurance in patient care. Exposure of unethical conduct of those physicians who are of unethical conduct. Payment of professional fees. Regarding payment of professional fees, this should be reasonable and evasion of the legal restriction. These are the duties of a physician in general. Duties to the patient: obligation to seek. Doctors has the patient delicacy and secrecy, maintain secrecy. Regarding prognosis, must not neglect the patient. Duties in regarding consultation and responsibility of physician to others, duties of physician to public as well as paramedics. Now come our duties in a nutshell. You can go through the Essentials of Forensic Medicine by KSN Reddy, or you can follow these from the Parikh's textbook of forensic medical jurisprudence. Doctors has the statutory duties. As a citizen of a country, you have this duty. This is the mandatory duty. That if there is any infectious disease or during treatment you found a person accused of or victim of serious crime, you must have to inform to the proper authority, that is in the crime. In that case, you have to inform police and infectious disease health authority, you have to inform the health authority. As a citizen of this, these are your duties. Not only as a citizen, but also as a medical person in the proper place, you have these duties. This is mandatory duty. And these are the duties. Whenever you accept a patient for treatment, these are the duties that you have to follow it. There are two types of duty. One is medical, another is medical legal. Medical duty regarding medical examination, regarding treatment of patient, regarding operation, regarding issuing certificate. And medical legal duties regarding in case of living and in case of death. Medical victim or accused may be living or dead. The victim of um, medical legal case in living case that are usually under the clinical forensic medicine, and the victim of the medical legal case, if he dead, it is perfect. It is the under forensic pathology. And there are some fiduciary duties. Let us see the medical duties regarding medical examination. Usually, regarding medical examination, that no need of any prerequisite. Only implied consent is enough. Implied or verbal consent is enough. But if you want to examine his or her private part, it is better to take expressed consent, verbal express consent. Appropriate investigation supportive, not mandatory. Hence, a duties of a doctor in medical examination regarding medical examination, no prerequisite is required. Implied or verbal consent is enough, but if you want to examine private part, express verbal consent, you can take express verbal consent. Now come to the treatment of patient. This is very much important. Number one, continue to treat with reasonable care. Reasonable care and skill. These two is the most important duties of a doctor. Continue to treat with reasonable care and skill. Keep the secrets inviolate. Proper instruction regarding diet, regarding drug, regarding advice. Don't go beyond your skill. If it is beyond your skill, you can consult another physician or refer the patient to proper person or proper place, etc. This duty is most important duties, and these are the actual duties of a doctor. Every doctor will have to face. These are the conditions where you can discontinue treatment. You have to continue your treatment with reasonable care and skill. And this reasonable care or skill, to make it update, you have to continuously update your professional competency. either by CME or CPD. Continuous professional development or continuous medical education, that is CME or CPD. Whenever you can discontinue treatment, if the patient wants to change doctor, if the patient does not follow your instruction about medicine, about diet, about drug, etc., if the patient is not paying your fees, you can notice him, you can inform him, and then discontinue your treatment. If the doctor is convinced that the patient has the paying illness, that is, patient is malingering. If the practitioner himself becomes sick, if another practitioner is also attending the patient without the knowledge of the doctor, if the patient continuously persists the doctor to use of intoxication, these are the conditions where a doctor is allowed to discontinue the treatment. Now come to the operation. Regarding operation, some duties pre-operative, during operation, and post-operative. Pre-operative fitness, you have to thoroughly examine for the pre-operative fitness, and pre-operative strictly maintain the advice during operation. The swab, the instrument should be counted and listed in the board, and also examine all the electric device or equipment, whether it function normally or not. And there are some post-operative. If you operate a person and operation is successful, but if you don't take any care in the post-operative period, and if there is a patient's condition is deteriorate, you will have to pay for this. That is, you have to face the negligence issues. Hence, regarding operation, pre-operative, there are some duties pre-operatively, during operation, and also the post-operatively. Regarding issuing certificate only that you examine, not guess, only the fact you have found it. Note at least 2 identification marks and signature of the patient with date. Now come to the medico-legal case. Medico-legal, in case of death, in medico-legal case, examination to examine a case, prerequisite must. But in medical case, prerequisite is not mandatory, no need of prerequisite. Prerequisite, then proper postmortem examination, and then postmortem report writing. These are the duties in case of death. Now come to the case of living, that is clinical forensic medicine. Regarding medical legal examination, regarding treatment of victim, regarding issuing certificate. This three is more important also. Regarding medical legal examination, in all cases of clinical forensic medicine, either rape victim examination or injury case examination or examination for impotency or examination for age determination or any other, in clinical forensic medicine, examination for drunk person, drunk driver, etc., you must follow this prerequisite. That is requisition from a law enforcing agency, that is requisition from a police officer not below the rank of sub-inspector or from the court or magistrate. Second is the identification of the victim by the accompanying police officer or constable. Then informed written consent. Remember the term informed written consent. What is informed written consent? Why written consent? It is very much important. You have to identify it. informed written consent, indication of informed consent, etc. Presence of a third person. Presence of a third person. If the victim is female, then female third person, and if the victim is male, then male third person. And this presence of third person for the sake of doctors. Hence, this third person will never be the attendance of the patient, but they will be your nurse or ward boy or ayah, etc. And attested photograph, 3 attached passport size photograph attested from the first class magistrate, first class gazetted officer, or from OC of the police station. Regarding medico-legal examination, on is prerequisite must, and secondly must supported by proper investigation. In case of medical case, we already told you that you can do investigation, but investigation is not mandatory. But in case of medical legal, indication must be supported by proper investigation. Now come to them regarding treatment of the victim of medical legal case. In the medical case, those who are sufferer, they are known as patient. In medical legal case, they are known as the victim. The sufferer are designated as victim. Regarding treatment of victim, there are 2 types of duty. One is medical duties, another is legal duty. Medical duty examine the victim and assess the condition. First, you examine the victim and assess the condition. Secondly, give life-saving management. Whatever needed, all the life-saving management. Life-saving management is your prime duty than legal duties. Legal duties, keep the relevant record. Keep the relevant record. All the relevant records should be noted, store it, preserve it, etc. Consultation when need further intervention. If there is a further intervention needed, then consult with another colleague. Arrange for dying declaration. Probably this dying, spelling of dying is not, probably this E will not hear. And dying, this is the person who are going to death at the before death, etc. The dying, not coloring. Please ignore this. Dying person, that is who as the last moment of his life. Hence, arrange for dying declaration. Don't issue death certificate if the victim died. Don't issue death certificate. If your death certificate recommend for post-mortem examination, never hand over the body to the party. Rather, you will hand over the body to the ward master. He will follow the subsequent um, procedure. Regarding issuing medical legal certificate. Regarding issuing certificate or report, preparing report, this report has 3 portion. On is preamble, which include the particulars of the victim. Second is the body of the report, and lastly opinion. This opinion should support your findings. Your findings should support your opinion, as because whenever you'll go to the court for evidence for giving deposition. If your finding not supporting your opinion, then you have been in trouble. That's why be careful regarding issuing certificate, and there are also some duties regarding this. Professional secrecy. This is a term in the medical duties. We already told you in case of medical regarding treatment of patient, continue to treat with reasonable care and skill, keep the secrets inviolate. This the this is duty. This duty indicate that you will keep the secrets about the patient's personal life, social life, family life, whatever he tell you, told you about um, about about her, his or her, you will keep the secrets inviolate. That is professional secrecy. Professional secrecy is an implied term of contract. Remember, it is an implied term of contract. Why it is implied? As because it is a tacit contract. It is not expressed. It is implied term of contract between a physician and a patient, where the physician is obliged to keep secrets all that he came to know concerning the patient, disclosure of which will be treated as a failure of trust and confidence. Patient has the trust and confidence upon you. For that, he or she give you the statement regarding her personal life, her social life, her family life, anything needed that he or she told you with this for this trust and confidence. If you disclose this secrecy, patient can sue against you. Patient can sue the doctor for damage if the disclosure is voluntarily and has resulted in harm and are of no public interest. This is professional secrecy. Hence, professional secrecy is an implied term of contract between physician and patient, where the physician is obliged to keep the secrets, disclosure of which will be treated as a failure of trust and confidence. And the patient can sue the doctor for damage if disclosed voluntarily. Secondly, has resulted in harm. Thirdly, is of no public interest. Professional secrecy. Don't discuss with other about the patient illness without his or her consent. Though you are paid by the master or by husband or by parents, if major don't disclose them to parent or relatives about patient illness without his or her consent, even though paying fees by them. Husband and wife. If the husband pay you for wife, don't disclose without his or her consent, either wife or wife's confidence to the husband. Exactly, master servant same this. If the government employee came to you for any purpose, he has the right of professional secrecy. Don't disclose it to the concerned authority or factory employee. Whenever come to you, you don't disclose to the factory authority without the consent of his or him. Under trial prisoner has the right of professional secrecy, but convicted prisoner, those prisoner who has already convicted, he or she has no right of professional secrecy. Under trial prisoner, in that case, under trial prisoner, in that case, you don't disclose the secrecy to the concerned authority. But in convicted prisoner, you can. Now, there are some conditions where you can disclose the secrecy of patient. That is privileged. You are privileged to communicate. Definition of privileged communication. These are the statement. Privileged communication are the statement made bona fide upon any subject matter to the concerned authority. Remember the term concerned authority. Duty, the doctor's duty to protect the interest of the community or of the state. That is privileged communication. So privileged communication is or are privileged communications is the statement made bona fide upon any subject matter to the concerned authority. Remember the term concerned authority. Only concerned authority can inform, not other than concerned authority. Due to your duty, that is doctor duty to protect the interest of the community or the state. To be privileged, the communication must be a person having interest in it. Now come to the examples. There are 5 on infectious disease. These are social and moral duties for self-interest, for patient interest, and if asked by the court of law. If in case of infectious disease, suppose a nurse suffering from gonorrhea or a kindergarten tutor dealing with the kids as suffering from gonorrhea. In that case, you first ask the concerned person, that is the nurse or teacher, to stop his duty until his or her disease is cured. If she failed to obey your advice, then you can inform to the concerned authority. That is either hospital authority or school authority in case of teacher. If a person is suffering from syphilis, gonorrhea, and take bath in a public swimming pool, you first advise the concerned person to avoid this. If you don't obey your command, then you can inform to the municipal authority. If a husband or wife suffering from sexually transmitted disease, you should advise to the couple not to meet until they come round. And if they don't follow your advice, then you can inform the concern. A person is going to marry a person if you know he or she is suffering from AIDS. In that case, you must inform to the concerned person. The concerned bride or groom. But if a person is suffering from venereal disease like gonorrhea, syphilis, which is curable, in that case, it is better to advise him or her not to marry until cured. Secondly, your social and moral duties. Suppose a person is suffering from a bus driver, or captain of a ship, or pilot is suffering from hypertension or color blindness or hearing problem, or bus driver. Then first you advise him or her to change this profession. If he don't obey your command, your advice, then you can inform to the concerned authority that your employee, as a pilot, driver, railway driver, or bus driver, or captain of the ship, suffering from epilepsy, hypertension, and it is risk for the public. This is your social and moral duties. And self-interest. Whenever a malpractice suit, a case is filed against you. For this, you can disclose this. Patient secrecy. Patient, if the patient is suffering from suicidal tendency or homicidal tendency, like this, you can inform to the parents. Court of law, if the judge asks you to disclose this, you cannot claim this, but you have to first told to the court that I will give in written. If the court instead of this order you to say in the verbal, then you can say it in the court. This is in short, we discuss all about the duties of a registered medical practitioner, and there are some suggested questions for you. What are the right and privilege of a doctor? What are the right and privilege of patient? What are the duties? Describe the duties of doctor regarding treatment of patient. This is very much important, and every doctors who practice he need this. That's why it is important for examination as well as all type, that is written or oral examination, and also for your practical life. Duties of a doctor regarding treatment of a patient. Describe the condition where doctor can discontinue treatment. What are the prerequisites for examination of victim or accused of medical legal case in case of living? There are 5 things in every case. You can add this. And also there are prerequisites for post-mortem examination, that is for death. How will you treat a victim of medical legal case? I have already discussed this. There are 2 sets of duties. One is medical measure, that is you examine and assess the condition, and then life-saving management. Secondly, inform to the police, keep the records, collect the samples, arrange for dying declaration, and if the victim died, then inform to the police, not issue the certificate, death certificate, rather recommend for post-mortem examination. If in the hospital, you can issue the certificate, but hand over this dead body and certificate to the ward master. He will follow the subsequent procedure. What is the privileged communication? Give examples. What is moral and social duties? It is very much important. And this is in short about your importance regarding duties. And also another is consent. Consent, I think in the next class I can discuss regarding consent. Or consent will be another topics. So we discuss today right and privilege of patient, right and privilege of doctor, right and privilege duties of a doctor, duties of a patient, and among the duties, professional secrecy. We discuss about professional secrecy. We discuss the privilege communication and rule of professional secrecy. Examples of professional privilege communication. Um, but we don't discuss regarding consent. This is another duty, and today probably time is will not permit us. Uh, thank you very much. Assalamu alaikum warahmatullahi wabarakatuh.